All right. Well, thank you very much for coming, Dr. Chen. I'm Cameron Sabet, and this is Cutting to the Case with Antonia Chen. Dr. Chen, could you kindly introduce yourselves to me and the rest of the audience?
Sure. My name is Antonia Chen. I'm an orthopedic surgeon who does hip and knee replacements. I'm chair and professor at UT Southwestern.
Absolutely. Just to begin, can we begin with your journey? You've held leadership positions at Harvard and now as chair of orthopedics at UT Southwestern. Looking back, what were the most formative moments that shaped your path into academic arthroplasty?
Interestingly enough, I think the path that was actually really crafted was from doing reviews. So doing journal reviews, starting as a resident actually, was what I first got interested in research. And then started doing research myself with the team at Pitt, where I was a resident. And then continued at Brigham, I mean, continued at Rothman Institute, where I was a fellow. And obviously with a very robust research program there, did a lot of research and got involved in orthopedics through the lens of research. I also got involved in industry through the lens of research as well, too. So research has really been the engine that has driven everything that I've done, mostly in orthopedics. Getting to Brigham, what I've really wanted to do is do some more leadership opportunities and shape what we did in total joint replacements. So I was afforded the opportunity to be the chief of arthroplasty at Brigham, which is great for gaining leadership experience, knowing how to maneuver within health systems and improving systems to improve our patients' lives, of course. And then that translated nicely to the chair role where I am now at UT Southwestern, which has been great.
Wow, what a journey. So you started really doing reviews as a resident and you just escalated from there. I am very curious, when you did those reviews, did industry reach out to you? Did you reach out to industry and how did that work? How did you gain notoriety in the academic world as well?
So really what it comes down to reviews is you do a lot of reviews, you do a good job with the reviews. They then reward you with different roles that you can do. Hence, deputy editor, now executive editor of JBJS. But then people who are reading reviews are people who are well known in the fields of hip and knee replacements, in the world of publishing, in the world of stuff like that. So I got asked to do like committees, give talks on different topics and things like that. And especially as you publish, there are certain topics that you become a quote expert in. So people look to you to speak on those topics. It's after being on the podium, being out there that industry looks at you then. So the industry really didn't seek out from the review standpoint, but you're on the podium, you're presenting, you're a leading expert in these areas, and that makes a big difference for people to reach out to you.
That's very interesting. I'm aware, at least among a lot of my classmates, when they want to gain academic notoriety, they seem to look for publishing avenues instead of having these face-to-face conversations at conferences and those keynote speeches. That's fascinating. So, additionally, you have published over 400 peer-reviewed papers and sit on multiple editorial boards. How do you approach that research productivity and that academic leadership while balancing that high-volume clinical and industry work?
So the biggest thing that it comes down to is the time and place for everything. And sometimes during the day, you just want to maximize your time. So if you're in between cases, let's say you have a really efficient system. Well, then if you're in a really efficient system, you can be done by 1 or 2 o'clock. If you have a less efficient system, then you maximize the time between cases to write papers, review papers, edit, things like that. And that makes a big difference in terms of your timing. I also say nights and weekends are unfortunately a time that we use to write papers and do research as well on top of our day job. So typically research tends to unfortunately add on to our days as opposed to make up for days. Now, if you're lucky enough to have protected research time or protective admin time, you can use that time to do research. But if you don't, you can still do a lot of research and you can still just do it on the times, unfortunately, that are probably more off cycle to keep your clinical productivity up.
Yeah, no, that's fascinating. And about the clinical productivity and research dissemination, you have also written books designed to democratize orthopedic knowledge, like the Little Ortho book. And I was reading a little bit about it. What motivated you to write for a broader audience, and how do you think we can better educate both patients and the non-surgeon workforce?
So that actually came when I was a resident. They had a little book called a little ophtho book. And because of that, the ophthalmologist had a book that was good to hang out to patients. They could read about it and things like that. So like we really want an ortho version. And what better place to be on than be a resident? Because everything is like really, you have to dumb everything down for us as residents and on top of it as a lay public. So I imagine if I was writing it for my mom or for parents of my mom's age and an audience where it would have been something a little bit different. where, you understand a fracture and a break may not be the same thing to them. And then so part of the education is that, I think part of it too is something that we do with our patients on a daily basis. Most of the patients that come to see me do not speak orthopedics, and they shouldn't. They're not orthopedic surgeons. And so my job is to break it down for them in my clinical practice. And why not do so in a book so that patients can read that ahead of time just to get a feel for it?
Yeah, yeah. And about that whole theme of dissemination to of the field and the enjoyment of the field to other people as well. Um, you have also been honored with the Nancy Tarbell Leadership Award at Harvard for advancing women's careers in medicine. And what advice would you give to young women entering orthopedics today or who are listening to this conversation?
What I always tell people, male or female, is be yourself. It's one of those things where don't be something just to quote fit into orthopedics because it's a long journey. It's one of those things where yes, you can get into residency and then you find out it's not a fit, or you get through residency and you're practicing attending and you find out it's not a fit. It's a long journey. You're here for the long marathon as opposed to the short sprint. So if you're not yourself and you can't be who you are, that's gonna be a really, really hard journey to be. Do ortho because you love it. Try to get involved as in many things as possible. I always say yes in the beginning as much as possible. Say no later, but say yes in the beginning. Because every time you say yes to something, your doors open up to something else and it opens up to something else. Now, what my other advice is, if you get something like a responsibility or something like that, then be sure to do a really good job with it. You definitely don't want to be halfway working through something and then you won't probably get another request back. So the idea is do something well, and do something that you're passionate about.
Absolutely. So commit only if you're ready for the marathon. Say yes in the beginning, be excited, and get the work done. And about that, these are themes that I've tried to emulate as your mentee. Actually, mentorship matters deeply, and especially in surgery. What kind of mentorship did you find most impactful early on, and what do you try to pass on now to your mentees?
I think mentorship, the idea is that there'll be certain people who can mentor you in certain ways that other people may not be able to do so. So, like having a mentor for clinical work, having a mentor for research work, having a mentor for leadership. There's different reasons that you look up to different people, and those people can all offer you different viewpoints and different expertise. And so, having a variety of mentors, I'm lucky to have many mentors, right? I don't have just one mentor because everyone has different strengths, right? So the idea is you go to different mentors for different reasons, for different advice, and that really makes a difference in terms of how you grow. Maybe your mentor is is a between first and second year of med school, or, your mentor the fourth year actually, right? Who's just matching orthopedics, and they're going to offer a very different perspective than attending who's been 10 years in the practice, 20 years in the practice, 30 years in the practice. They're able to mentor in all different ways, but I think it's really key to find someone who you relate to, and can understand a certain area that you're talking about.
Yeah, yeah. And so about the concept of mentorship, as chair of UT Southwestern, this is a huge role. And what's your vision for the department over the next 5 years or so?
Ideal part of the department is to do a few things, which is true probably for every single department in the entire nation. One, to be clinically excellent. Two, to be research strong. And three, to continue educating in an excellent manner. Our residency is over 100 years old, which is fantastic. And we can continue on to grow it, develop it, develop more experiences, both nationally, internationally, and electives as well as within our own program. From a research perspective, we want to grow our presence in the research realm, both prospective and retrospective studies, of those multi-center studies. And of course, clinical excellence is number one. Without clinical excellence, nothing else follows that. So we want to make sure that we are clinically excellent in everything that we do, which trains residents well and is able to conduct good research in that realm too.
Yeah, yeah, absolutely. Those are fantastic goals, and I can see why they chose you for this role. So, just final question, because I really want to be respectful of your time here. What's one lesson you learned from orthopedics that stayed with you outside the OR?
The one thing I probably stay outside of the orthopedics to stay with me is stay grounded. I think that's one of the things where, I think we all have friends who are outside of medicine, people we've known for a long period of time, and they're some of the best people that I like hanging out with because they keep me grounded. Like to them, I'm just Antonia, right? I'm not chair of orthopedics. I'm not all these sorts of things, which is, all wonderful things. And I'm excited for what the future holds and what I've had so far, which is great. But staying grounded, I think, is something that's been really helpful to have. And that applies in all areas of life.
Wow. Yeah, very insightful. Thank you very much for sharing all this. And I really appreciate you coming to this podcast.
Always good. Thanks for keeping that. And thanks for inspiring the next generation.
Absolutely. Thank you very much. And yeah, until next time, cutting to the case with ortho. Thank you. Bye bye.
All right.